Hi, this is Long. Welcome to our video series on search patterns for the most common studies in radiology. Please note that this is an introduction to study interpretation. An enormous amount of detail is omitted for brevity. Continue dedicated reading, seeing as many cases as possible, and keep getting feedback from subspecialists during the course of your training. All right, so today we're going to talk about a basic approach to the ankle radiograph. As usual, you're going to want to take a look at the patient's history, see what the indication is for the current study, and correlate over prior studies to see if the patient's imaged before or has any known underlying abnormality. We're going to take a look at all the views provided, see if there's any limitations to those views, and then in a step-by-step manner, we're going to go through every single view, looking at every osseous structure for fractures or focal osseous lesions. You'll look for alignment, particularly at the ankle mortise and at the syndesmosis. We'll look for deformities of osseous structures at the ankle or degenerative changes. And then finally, we'll look at soft tissues, looking for joint effusion at the ankle and anything else that we might image. So taking a look at this particular study, we've got three views of the ankle: a frontal, kind of an oblique view through the ankle mortise. That lays that out nicely, and then a lateral view. All right, and then once you have a sense of what's going on with the patient and done all the requisite background understanding, we're going to take a look at the frontal view, and you're going to trace every single cortex: the distal tibia and fibula, along the talar dome, the tibial plafond. All the incidentally imaged or the imaged portions of the tarsal bones and metatarsals, as you see at the lower aspect of the study. You want to be particularly careful to look at through overlapping structures, and you want to do this on every single view. And you want to be very careful that you don't miss kind of edge of the film sort of findings. The base of the fifth metatarsal, for instance, and then on the lateral view, anterior aspect of the calcaneus as a frequent blind spot. Sustentaculum tali, the posterior aspect of the calcaneus, kind of down here in this busy area of the tarsal bones, looking through distal tibia to the fibula behind it, and just making sure there's not any sort of subtle fracture there. Also on the lateral view, to kind of get a sense of fracture, you want to look at the Bowler's angle, the angle is just saying, to see if there's any sort of kind of abnormality in those, and that can kind of tip you off to subtle sort of fractures. In addition, we want to take a look on the oblique view, which lays out kind of like the alignment very well. Look to see that there's an equal spacing along the ankle mortise. Look that there is close or normal apposition along the syndesmosis between the distal tibia and fibula, and that this space is basically kind of symmetric along the medial and lateral aspects of the mortise. We're going to be looking, in addition for fractures, and dislocations or malalignment, you're going to look for abnormal osseous lesions, sclerotic, lucent, and particularly carefully for osteochondral lesions at the talar dome. On the lateral view, you can see, deformity in the form of that C sign or like anteater sign, kind of like abnormal elongation of the anterior calcaneal process or continuation here between the sustentaculum tali and the calcaneus here, and then ultimately on these views, we're going to make sure we take a look at all the soft tissues carefully, in particular looking for an effusion at the ankle, which you can kind of see as displacement of this fat anteriorly and with soft tissue density, and kind of like a kind of a convex shape posterior to that fat pad. And then for all these, we're going to make sure that we take a look at the edges of the study again and correlate any findings we see across the differing views, and that basically covers an approach to the ankle. In summary, you want to get a good understanding of what's going on with the patient, take a look at any limitations, and then we're going to go through each view very carefully, looking for subtle fracture or abnormality, looking for malalignment at the mortise, at the syndesmosis, and then looking for any sort of underlying degeneration or deformity, and then finally looking for effusion and other abnormalities in the soft tissues.